Welcome to an overview of blood results. This is not an exhaustive list of all blood results. All the tests discussed in this lecture are taken from blood drawn from a vein in your arm. This brief overview is going to look at hemoglobin, white blood cell count, C-reactive protein, some clotting factors, and will also provide a list of other commonly used blood results. White blood cells are critical in our immunity. They fight off viruses and bacteria which threaten our health by rushing to the area. White blood cells are made by the bone marrow and are stored in the blood and lymph tissue. There are many types of white blood cell. Monocytes help fight bacteria. Lymphocytes help create antibodies to help fight viruses and bacteria. Neutrophils kill and digest bacteria and fungus and are our first line of defence. Basophils secrete chemicals such as histamine, which are an indicator of an allergic disease. Eosinophils attack and kill parasites and cancer cells and help with allergic responses. When white blood cell levels are increased, it's a sign of infection, and the cells are multiplying in order to destroy the bacteria or virus. When they are decreased, it's either something destroying them or the bone marrow is not making enough. If somebody has a low white blood cell count, they're more at risk of infection and of serious illness. Hemoglobin is found in your red blood cells. It is responsible for carrying oxygen from the lungs to the cells. Low hemoglobin is known as anemia. This means that the body is not getting enough oxygen. This means that your patient might be weak, fatigued, or breathless. This is particularly important when working in areas where your patient has had surgery, including orthopaedics. You should avoid mobilising your patient or exercising them if they have extreme anemia, as they're at risk of cardiac ischemia. If your patient has an increased hemoglobin, this may indicate that there's too many red cells, and this is called polycythemia. The blood can become too thick, therefore increasing the chances of stroke. CRP is a commonly used blood test. CRP is an inflammatory marker. The CRP is an indication of an inflammatory process within the body. This can either be an infection or a flare-up of a chronic inflammatory disease. With a respiratory patient, an increase in CRP could be a sign of an acute chest infection. The Ddimer result shows whether or not there is a thrombus or a clot within the blood. In particular, when we talk about clots, we're talking about either a pulmonary embolus, which is found in the lungs, or a deep vein thrombosis, which is found in the deep veins of the legs. The Ddimer is generally carried out if the patient is showing signs of a DVT, so they may have symptoms of leg pain, edema, or discoloration, or signs of a PE, so if they've got increased shortness of breath, cough, and chest pain. The doctors will be looking to rule out whether or not a clot's involved. If the Ddimer result is elevated, it is a sign that there is a significant clot formation somewhere within the body. It does not tell us where the clot is. INR measures how long it takes for your blood to clot. It involves looking at a protein called prothrombin, which is produced by the liver. INR tends to be carried out for a patient who is taking anticoagulant medication such as warfarin. A high INR above 5 indicates that there's a high risk of bleeding, and a low INR indicates there's a high risk of clotting, which therefore puts your patient at increased risk of a deep thrombosis or a pulmonary embolism. Here are some other common lab results for your information. You don't need to know all of these off by heart, but you may want to take note of these along with the other ones we have discussed before you go out on placement. As you can see, they have an effect on the physiotherapy intervention.